Hello, I'm Tracy Todd, Executive Director of the American Association for Marriage and Family Therapy.
And I'm Jill Epstein, Chief Executive Officer of the California Association of Marriage and Family Therapists. And today we are thrilled to inform you about an historic joint venture between CAMFT and AAMFT.
As many members know, both AAMFT and CAMFT have long-standing histories in protecting and advancing the professional interests of marriage and family therapists. Furthermore, many members of both organizations are well aware that relations between AAMFT and CAMFT have not always been as collaborative as may be possible. Recognizing that we are stronger when working together rather than independently, Jill and I are committed to collaborating on professional issues that are critically important to MFTs in California, the United States, and throughout the world. One of those issues in the United States is, of course, Medicare.
Tracy and I are excited to announce that CAMFT and AAMFT have agreed to partner to fund an economic impact study. The study will examine the cost and savings factors for Medicare Part B coverage of private practice marriage and family therapists. Legislation to include LMFTs as eligible Part B practitioners has recently been proposed in the Senate, and a House bill is expected this fall. While this legislation has passed previously in both houses of Congress, it has never passed in both houses in the same year, and our hope is that this study will be a catalyst in getting LMFT inclusion. If the research demonstrates lower costs than the Congressional Budget Office currently predicts, we believe we will find more supporters on Capitol Hill. We already know that LMFTs are among the most highly educated and dedicated mental health professionals. They embrace the holistic view of healthcare that is integral to long-term well-being, and we know they can be of immense benefit to Medicare recipients.
By commissioning this economic impact study now, we hope to be able to have the necessary data and analysis that will improve the chances of this and future legislation being successfully enacted. Because this is an independently commissioned study, our groups have no input on the outcome. However, we are optimistic that this research will give us definitive evidence of the immense benefits the field of marriage and family therapy has over potential cost of its inclusion. We anticipate early results of the study to be available this fall and the final report in early 2014.
For CAMFT members, more information on this study can be found in the September-October issue of The Therapist.
For AAMFT members, more information can be found in the July-August issue of Family Therapy.
Tracy and I thank you for taking the time to watch this video, and we encourage you to follow all developments via the multiple social media platforms of both associations.